The Hybrid Assistive Limb, also known as the HAL, is the first medical exoskeleton powered by the wearer's intention to move. HAL is the only medical exoskeleton that the FDA has cleared to actually improve function and ambulation in patients with stroke, spinal cord injuries, and progressive neuromuscular disorders. There's a lot of research out to support the use of HAL with patients with Parkinson's disease, traumatic brain injury, multiple sclerosis, ALS, and many other progressive neuromuscular disorders. When an able-bodied person wants to complete a movement, it's initiated at the brain level and follows along a neural pathway to the body part that they're trying to move. When a person's experienced a disease or a disorder such as progressive neuromuscular disease, that pathway is impacted and they're unable to complete a feedback loop that helps them successfully complete tasks. Through sensors placed on the skin, the HAL can pick up faint nerve signals. By activating the motors within the HAL, it helps the user complete these actions. This creates a positive feedback loop that can strengthen, reinforce, and even rebuild neural pathways.
For demonstration purposes, we have the electrodes attached to Hiroki's arm. In reality, the electrodes would be on the wearer's leg for this device.
As you can see, when the arm moves, the HAL picks up nerve signals at the skin level to move the device. Now, if you're unable to move, the HAL can still pick up nerve signals and read the wearer's intention to move. If I physically stop him from moving, but he tries to move his arm, the HAL can pick up that signal and still move. Up, down, up, down. To prove even further that the HAL is indeed reading the wearer's intention to move and rather not just copying the movement, if the movement isn't initiated by the brain, then the HAL doesn't copy the movement.
Watch what happens if Hiroki completely relaxes his arm, but I move it for him. See? It does not replicate the movement.
Even in severe cases, such as spinal cord injury, we can adjust the settings on the HAL to increase its sensitivity. The user only needs to visualize a movement for the HAL to read the user's intention to move. Up, up, up.
The HAL is specifically designed to help improve ambulation, and other exoskeletons provide ambulation. When you're walking with the device, you can walk better, but when the device comes off, are you actually better? The HAL makes sure that when the device comes off, you are actually improving in your ability to walk independently and with less assistive devices. HAL therapy can correct multiple aspects of gait technique, including loading, initiation of the swing phase, weight shifting, improved stride length, and posture. HAL enables pre-gait activities such as leg lifts, lunges, squats, and walking backwards. Rise Healthcare Group offers 3 different devices: the lower limb type, which works on the legs to improve ambulation, the lumbar type, which works on trunk control, and the single joint type, which is used on the elbows, knees, and ankle joints.
Combined with Rise Healthcare Group's unique approach to physical therapy, the HAL can slow the progression of many neuromuscular disorders and increase patient independence, confidence, and quality of life. Everyone knows somebody who's experienced a stroke, spinal cord injury, or a progressive neuromuscular disorder. HAL being the first exoskeleton to help patients actually improve their function is a life-changing experience for those patients. Contact us to help find out how we can help support you or your loved ones.